Don't stop. Don't stop. Don't stop. Don't stop. Don't stop. Don't stop. Don't stop.
Mediastinum, Introduction. Mediastinum, Latin intermediate, is the middle space left in the thoracic cavity in between the lungs. Its most important content is the heart enclosed in the pericardium in the middle part of the inferior mediastinum or the middle mediastinum. Above it, lies superior mediastinum. Anterior and posterior to the heart are anterior mediastinum and posterior mediastinum respectively. The mediastinum is the median septum of the thorax between the two lungs. It includes the mediastinal pleurae. Dissection, reflect the upper half of manubrium sterni upwards and study the boundaries and contents of superior and three divisions of the inferior mediastinum. Boundaries. Anteriorly, sternum. Posteriorly, vertebral column. Superiorly, thoracic inlet. Inferiorly, diaphragm. On each side, mediastinal pleura. Divisions. For descriptive purposes, the mediastinum is divided into the superior mediastinum and the inferior mediastinum. The inferior mediastinum is further divided into the anterior, middle, and posterior mediastinum, Fig 17.1. The superior mediastinum is separated from the inferior by an imaginary plane passing through the sternal angle anteriorly and the lower border of the body of the fourth thoracic vertebra posteriorly. The inferior mediastinum is subdivided into three parts by the pericardium. The area in front of the pericardium is the anterior mediastinum. The area behind the pericardium is the posterior mediastinum. The pericardium and its contents form the middle mediastinum. Superior mediastinum. Boundaries. Anteriorly. Upper four thoracic vertebrae. Superiorly, plane of the thoracic inlet. Inferiorly, an imaginary plane passing through the sternal angle in front, and the lower border of the body of the fourth thoracic vertebra behind. On each side, mediastinal pleura contents, 1 trachea and esophagus. 2 muscles, 1 origin of sternohyoid. 2 sternothyroid. 3 lower end of longus colli. 3 arteries, 1 arch of aorta. 2 brachiocephalic artery. 3 left common catotid artery. 4 left common carotid artery. 5 left subclavian artery. 4 veins, I right and left brachiocephalic veins. 2. Upper half of the superior vena cava. 3. Left superior intercostal vein. 5 nerves, I, vagus. 2. Phrenic. 3. Cardiac nerves of both sides. 4. Left recurrent laryngeal nerve. 6 thymus. 7 thoracic duct. 8 lymph nodes, paratracheal, brachiocephalic, and tracheobronchial. The inferior mediastinum is divided into anterior, middle, and posterior mediastina. These are as follows: anterior mediastinum. Anterior mediastinum is a very narrow space in front of the pericardium, overlapped by the thin anterior borders of both lungs. It is continuous through the boundaries. Anteriorly, body of sternum. Posteriorly, pericardium. Superiorly, imaginary plane separating the superior mediastinum from inferior mediastinum. Inferiorly, superior surface of diaphragm. On each silk, mediastinal pleura. Contents: 1 sternopericardial ligament. 2 lymph nodes with lymphatics. 3 small mediastinal branches of the internal thoracic artery. 4 the lowest part of thymus. 5 areolar tissue. Middle mediastinum. Middle mediastinum is occupied by the pericardium and its contents, along with the phrenic nerves and the pericardiaco-phrenic vessels. Boundaries: anteriorly, stemopericardial ligaments. Posteriorly, esophagus, descending thoracic aorta, azygous vein, see Figs 15.1 and 15.2. On each side. Mediastinal pleura. Contents: 1 heart enclosed in pericardium. 2 arteries, I ascending aorta. 2 pulmonary trunk. 3 the 2 pulmonary arteries. 1 reins, I, lower half of the superior vena cava. 2, terminal part of the azygous vein. 3, right and left pulmonary veins. 2 nerves phrenic. 2 deep cardiac plexus. 3 lymph nodes, tracheobronchial nodes. 4 tubes, I bifurcation of trachea. 2 the right and left principal bronchi. Posterior mediastinum. Bindaries, anteriorly I pericardium. 2 bifurcation of trachea. 3 pulmonary vessels. 4 posterior part of the upper surface of the diaphragm. Posteriorly, lower 8 thoracic vertebrae and intervening discs. On each side, mediastinal pleura. A contents: 1 esophagus, Fig 17.4. 2 arteries, descending thoracic aorta and its branches. 3 veins, I, azygous vein. 2, herniazygous vein. 3, accessory hemiazygous vein. Nerves, I, vagi, M, splanchnic nerves, greater, lesser and least, arising from the lower 8 thoracic ganglia of the sympathetic chain, see Fig 15.1. Superior mediastinum, A posterior mediastinal lymph nodes lying alongside of the aorta. B the thoracic duct. The prevertebral layer of the deep cervical fascia extends to the superior mediastinum, and is attached to the 4th thoracic vertebra. An infection present in the neck behind this fascia can pass down into the superior mediastinum but not lower down. The pretracheal fascia of the neck also extends to the superior mediastinum, where it blends with the arch of the aorta. Neck infections between the pretracheal and prevertebral fasciae can spread into the superior mediastinum, and through it into the posterior mediastinum. Thus mediastinitis can result from infections in the neck. There is very little loose connective tissue between the mobile organs of the mediastinum. Therefore, the space can be readily dilated by inflammatory fluids, neoplasms, etc. 3 in the superior mediastinum, all large veins are on the right side and the arteries on the left side. During increased blood flow, veins expand at all. Thus there is much dead space on the right side, and it is into this space that tumor or fluids of the mediastinum tend to project, Fig 17.5. Compression of mediastinal structures by any tumor gives rise to a group of symptoms known as meninspinal syndrome. The common symptoms are as follows. Obstruction of superior vena cava gives rise to engorgement of veins in the upper half of the body. B. Pressure over the trachea causes diapnoea and cough. B. Pressure on esophagus causes dysphagia. C. Pressure or the left recurrent laryngeal nerve gives rise to hoarseness of voice, dysphonia. D. Pressure on the phrenic nerve causes paralysis of the diaphragm on that side. F. Pressure on the intercostal nerves gives rise to pain in the area supplied by them. It is called intercostal neuralgia. Pressure on the vertebral column may cause erosion of the vertebral bodies. The common causes of mediastinal syndrome are bronchogeritic carcinoma, Hodgkin's disease causing enlargement of the mediastinal lymph nodes, aneurysm or dilatation of the aorta, etc. Mnemonics: sure rear mediastinum. Contents: PVT left battle phrenic nerve. Vagus nerve. Thoracic duct. Left recurrent laryngeal nerve, not the right. Brachiocephalic veins. Aortic arch, and its point 1 branches. Thymus YMPH nodes. Trachea. Esophagus. Mediastinum is the middle space between the lungs. It is chiefly occupied by the heart enclosed in pericardium with blood vessels and nerves. Black small square unit structures in the superior mediasternum are trachea, esophagus, left recurrent laryngeal nerve between the 2 tubes and thoracic duct on the left of the esophagus.